Imagine this. You twist your knee while climbing a flight of stairs or during your game. Now there's a sharp pain, your knee swells, and the doctor tells you it's a torn meniscus. Now you're staring at a treatment plan that includes the dreaded word, surgery. But wait, do you really need it? Before you rush to the operating room, let's break down if surgery is really the best option for everyone. Now first things first, the meniscus is like a shock absorber for your knees. It's a crescent-shaped cushion made of cartilage that helps stabilize your knee joint and absorbs impact. Now when you hear the word tear, it might sound alarming, but not all meniscal tears are created equal. They vary in size, location, and most importantly in their symptoms. And these factors play a huge role in deciding whether you should go under the knife. Now not every meniscal tear requires surgery. Many people, especially those with a small stable tear, can recover with physical therapy and time. Rest, ice, compression, and elevation, or the RICE protocol, is often effective for minor tears or those tears that don't cause enough instability or pain. Physical therapy focuses on strengthening the muscles around your knee to provide better support. With this treatment, many people return to their normal activities without ever needing a surgery. But there are certain cases where surgery is the better option. For instance, if the tear is large, causing your knee to lock or buckle, or if the pain just doesn't go away despite months of conservative treatment, surgery might be necessary. Now, younger and more active individuals may opt for surgery to restore full function and reduce the incidence of future joint issues. On the flip side, if you're older and have the degenerative tear, meaning the wear and tear kind that comes with age, non-surgical options might be more suitable for you. Surgery in these cases might not improve outcomes as much. The type of surgery also matters. Some tears can be repaired where the torn piece is stitched back, while others may require trimming away of the damaged part, also known as a partial meniscectomy. Now here's something very important to know, especially if you're a young or active individual. Meniscal repair should always be the first choice if it is an option. Why? Because repairing allows your body to keep as much of the meniscus intact as possible, thereby preserving its natural cushioning and shock absorbing properties. On the other hand, a partial meniscectomy, where the damaged portion is trimmed away, is generally seen as a last resort. While it can relieve pain and improve function, removing even a small part of the meniscus can slightly increase the risk of arthritis in the long run. So it's crucial to have an open and detailed conversation with your doctor about the type of surgery that's being planned. So should everyone with a torn meniscus get surgery? Absolutely not. That decision depends on the type of tear, the symptoms that you have, your activity level, and even your age. This is where your doctor plays a crucial role in guiding you to the best treatment for your specific situation. If you or someone you know is dealing with a meniscal tear, don't jump to any conclusion about surgery. Talk to an experienced orthopedic doctor, weigh in your options, and make an informed decision. And if you found this video helpful, don't forget to give it a thumbs up and share it with someone who might need to see it. Subscribe for more orthopedic related health tips and see you in the next one. Bye bye.